Hi, everyone. Good afternoon. This is Ramatu Mohammed, your host for the GAIPSEC Parent Webinar Series. Today, we're going to have a webinar on benefits navigation. My name is Ramatu Mohammed. I'm the Family Support Specialist for Center for Leadership in Disability, and I'm the Parent Coordinator of IDEAL Program. I'm also a parent of 4 children, and my daughter is living with disabilities, my oldest daughter, and I'm your host. This is Sally Atwell.
Hi.
So a little bit about Sally. Sally is the project director of the Shepherd Center's Benefit Navigator project. Before we start this webinar, a few things to note is that everyone except the presenter will be muted during the presentation. While the presentation is going on, you may wish to drop any questions in the question bar. And if you're using a phone and you can't type in your questions, you could use the raise your hand option, and I would unmute you to ask your questions verbally at the end of the presentation. All questions will be answered at the end of the presentation. So Sally,
okay,
you can say a little bit hello.
Hi, good afternoon, everyone. Thank you for being here, and thank you to Ramatu for being my technology person. And today we're going to be talking about the 2 programs that Social Security has for people with disabilities and what happens when you go to work in each of those programs. And I just want to say real quick that Benefits Navigator, the program that I manage, is one of 2 what are called Work Incentive Planning and Assistance programs funded in a cooperative agreement with the Social Security Administration that serve Georgians with disabilities. Our program is based at the Shepherd Center, and the other program is under the auspices of the Georgia Vocational Rehabilitation Agency. The staff have had the same training, and we all provide the same services. It depends on what county you live in as to which program serves you. Our program serves 40 counties of the state, including the metro area, and the VR project serves the other 109 counties, more of the rural area. And if people have questions about which county they're served under, I can email something to Ramatu that she can share with the group that will give that breakdown. So we are based at Shepherd, but we are funded through Social Security, and so our services are free, and they are available to anyone with any type of disability who is receiving benefits and has questions about what happens when I go to work.
Okay, so it's time for us to share the screen. Okay, we need to start the slide. Hold on a little bit. Start the slideshow. Okay.
All right.
Let me change the name too. You can start.
Okay. So first we're going to talk about eligibility for the 2 programs that Social Security administers for people with disabilities. Social Security, the 2 programs are Social Security Disability, or SSDI, and Supplemental Security Income, or SSI.
I want to change it to your name so that they see that it's
okay.
Talking. So.
Okay. How do I get it to change?
Sorry.
Okay. Okay, so first, Social Security is funded through Federal Insurance Contributions Act, FICA, payroll taxes. And this is what is referred to as retirement, survivors, and disabled individuals. So this is what SSDI comes out of. This is where our money comes out when we retire. And this is also where if a child has a parent who has passed away or retired, survivors' benefits come out of this same pot. As it says, it's insurance for the wage earner and certain other eligible family members, spouses, widows, widowers, and children. The disabled adult child is one category under SSDI. This is an individual who is at least age 18 and was disabled prior to age 22. This will be the child of an insured wage earner who is retired, disabled, or deceased. And the individual has to be evaluated on the adult rules for disability. So the soonest that you can qualify as a disabled adult child is 18. So for example, if someone is drawing a check on a parent who is deceased and that individual also has a disability prior to age 18, they should be evaluated by Social Security, and if they are determined to meet the disability standards, they can continue to draw that check even after they turn 19 and leave school as a disabled adult child. Social Security defines disability as a physical or mental condition lasting at least 12 months that prevents you from engaging in what is called substantial gainful activity, which is a specific level of work and employment that we will talk more about later in the presentation. When you get Social Security disability, either as a disabled adult child or as a disabled individual on your own work record, you automatically get Medicare, which is the health insurance that comes with SSDI and disabled adult child benefits, but you have to have received the check for 24 months. And as you can see on the example of the card, Medicare has two parts. Part A is hospital. Social Security pays that for you. Part B pays for doctor's visits. There is a premium for that, which in some cases may come out of the Social Security check. And there's more about Medicare, but we don't have time. That would have to probably be a separate webinar to go over the whole Medicare menu. SSI, or Supplemental Security Income, is, as you can see, a federal supplemental income program that is funded by general tax revenues, not Social Security taxes. Because SSI is a needs-based program as opposed to SSDI, which is an entitlement program, when you file for SSI, income and resources are taken into account in determining eligibility, regardless of what the disabling condition might be. And in some cases, income and resources of family members may also affect eligibility. If the individual is under age 18, or if the individual is married, spousal or parental income can impact the eligibility for SSI. The individual must be disabled or blind. And one good thing in Georgia, if you get SSI, you are automatically eligible for Medicaid, which is the health insurance that comes with SSI. The disability determination or definition is basically the same, except for with SSI, there is a difference between the definition of disability for a child and an adult. And when an individual turns 18, if they are already getting SSI, they have to be reevaluated using the adult standards of disability. Oh, I just said all this stuff. Parents' income and resources are considered under age 18, disability evaluated under the child's criteria, and reviewed at age 18. SSI can continue if the individual meets the adult disability criteria. They summed it up very nicely. Once an individual is over 18, only that individual's income and resources are considered. So many times, if you have a child who's disabled, who did not qualify because of parents' income and resources, when they're under 18, once they turn 18, if you're interested in applying for that benefit, that's a good time to apply. And then the adult definition of disability does apply as opposed to the child definition. And what I have heard from Social Security and what I have seen work best is to wait until the month after the month the individual turns 18 to file, because then there can be no question of the parent's income and resources being part of the equation. So those are the basics about eligibility. You've got financial criteria for SSDI. Either you have to work and have paid into the system, or with SSI, you have to meet a certain resource and income limits to qualify. So there's the disability eligibility piece, and there's the financial piece. So now we're going to talk a little bit more about these programs when it comes to going to work. And as we said, Social Security has the two separate programs, and the rules about working are completely different for SSDI and SSI. So that's always the first question we ask. And sometimes people aren't sure what they get, but there's a pretty easy way to find out. Usually if someone tells me their check comes on the first of the month and it's for $771 or less, they get SSI. If the check comes later in the month, and it can be on the 3rd or it can be on a certain Wednesday or Thursday based on the birth date, and the check is for a variety of amounts because it's based on what's been paid in, that's SSDI. So we're going to start by talking about SSDI. And again, this is the program for people who have worked and paid into the Social Security system. And with SSDI, you get a work incentive called a trial work period. This is a period of 9 months when earnings do not affect the SSDI benefits. These months can be spread out over a 60-month period, and they do not have to be consecutive. Because of the fact that the trial work period months are not consecutive, Social Security each year assigns what I call a trigger amount of earnings that lets them know when someone has entered one of their 9 months. And so this year, in 2019, you do not start using a trial month until your gross monthly wages are over $880 per month. Or if you are self-employed, if you work more than 80 hours in your self-employment venture in a month, that would also trigger use of a trial work period month, regardless of what the earnings were. And again, the 880 is not a limit. It's simply a trigger or marker that lets Social Security know you have started using one of the 9 months. Because in that month, you could earn $5,000 and you would still be eligible for your SSDI cash benefit. After the trial work period ends, that's when the term substantial gainful activity becomes important. Substantial gainful activity refers to an amount of gross monthly earnings that is set each year by the Social Security Administration. $1,220 a month is what's called substantial gainful activity for this year. And it usually goes up a little bit every year. For people whose disability is blindness, there is a higher substantial gainful activity level. That's $2,040 a month for people whose disability is blindness. So at the end of that 9-month trial, that's when Social Security is going to evaluate the earnings for someone on SSDI and make a determination about whether or not they can keep their disability check. So if that individual is making $1,220 a month or less, they can continue to draw their full disability check, and they can keep on doing that indefinitely as long as they are still considered disabled by Social Security's rules, and as long as their earnings meet the substantial gainful activity guidelines for the year. Now, you can see that there are 2 other work incentives listed here. One is impairment-related work expenses, and one is subsidy and special conditions. These are both considered when Social Security is determining whether or not someone's earnings will be above or below the substantial gainful activity level. Impairment-related work expenses refers to the cost of certain impairment-related items or services that are paid for by the beneficiary, not reimbursed by another source, and they are disability related, and they are also necessary for that person to work. So some examples would be copays for medication or therapy or any other type of treatment. If someone has a job coach and they don't have a waiver and they're paying out of pocket for that job coach, that would be an impairment-related work expense. If someone has to pay for special transportation like MARTA Mobility, and I have seen them also approve Lyft and Uber as impairment-related work expenses, those costs could be used as impairment-related work expenses. Also, if you have a service animal, a lot of times nowadays people are using service animals for a wide variety of situations, and if that animal accompanies you to work, all the cost of the service animal, vet bills, grooming, and food can be used as impairment-related work expenses. So exactly how would that work? Well, you remember, as we saw on this previous slide, this year, if you've used up your trial period and you're earning over $1,220, Social Security considers that to be substantial gainful activity. So let's say your family member is earning $1,400 a month, so they're over the limit. However, they have $200 a month of potential impairment-related work expenses, transportation costs, and copays for medication and therapy. So you would take those receipts to the Social Security office and present them for approval as impairment-related work expenses. If they were approved, then you would get a credit for that amount. So Social Security does not pay you for transportation or for these copays. What they do is give you a credit for the amount, and that credit reduces how much of your wages are counted. So if you were earning $1,400 a month, but you had a credit of $200 for impairment-related work expenses, Social Security would only consider you to be earning $1,200 a month. So you would still be eligible for your full benefit, and you could be earning $1,400 a month. The other work incentive that was mentioned was subsidy and special conditions. And I want to talk about that for a minute as well, because that can be particularly helpful for individuals who have intellectual and developmental disabilities. Subsidy and special conditions refers to any type of extra help that an individual receives on the job. So for example, if your family member has job coaching, a job coach helps them on site, checks in on them, even if you have a waiver and the waiver pays for the job coaching. The fact that there is a job coach involved can indicate the presence of subsidy and special conditions. And there is a certain credit that is given for the number of hours of job coaching per month. If the job duties are modified, if an individual has a lower productivity standard, or perhaps less duties, or they take extra rest breaks, or they have what's called natural supports, coworkers that might assist them, that is also part of the subsidy and special condition. And that, again, could allow Social Security to count less of an individual's wages and allow them to earn over that $1,220 and still keep their full Social Security benefit. These two work incentives, impairment-related work expenses and subsidy and special conditions, only apply after the trial work period because they are used in making the determination regarding the substantial gainful activity and the continued eligibility for the disability check. So the Medicare health insurance will continue even if the individual goes to work full-time and their check stops. as long as you are getting the disability check, you will have your Medicare. But if your cash benefit stops because your work is more than the SGA amount after the trial work period, you will still have Medicare eligibility for at least 93 months, which is a little over 7 years. And after that period ends, there is a specific Medicare for disabled individuals who work, and it's a special program that allows people to purchase the entire Medicare package. So a lot of times people are most worried about losing their health care, and the Medicare can continue for the 93 months, and then after that, the individual can purchase the Medicare if they want to keep Medicare as their health insurance. And I want to mention one other work incentive that is not on the slide that follows the trial work period. After you complete the 9 months, you have a 3-year window called the extended period of eligibility, during which, if your check has been suspended because your earnings are above SGA, you can get that check started back without a new disability evaluation or a new application. So you have the 9-month trial, and then at the end of that time, you have the 36-month extended period of eligibility, where if your earnings drop for any reason, let's say you get a great full-time job, but then the company goes out of business, or you get laid off, or you move to another state and have to start over. For whatever reason, you can get your disability check restarted without any application or disability decision. And that's 36 months. That does run consecutively, that follows the 9-month trial. After that 36 months, there is a work incentive called expedited reinstatement of benefits. And this work incentive applies after either SSDI or SSI disability benefits end based on your work. Expedited reinstatement, so what that would mean, let me back up, is that your cash benefit terminated. You're no longer eligible for the check. And so you have 60 months during which you can request reinstatement after your disability benefits have ended due to work. And it is a quicker, easier reinstatement process. Social Security restarts the check right away and pays 6 months of provisional benefits while they are reviewing the disability determination. So for expedited reinstatement, it's not like when you first apply and you have to prove that you're disabled. You get a less stringent disability criteria, which is the one that is used when they do a disability review. They are checking to see if the disability of record still exists. So you have 6 months of benefits while they review, and then generally, I think in the years I've been doing this, I've only had one person who was not determined disabled and continued getting the benefits. If at the end of the 6 months they determine that you are not disabled, you do not have to pay the 6 months of benefits back. Vocational rehabilitation. This work incentive, we often call it Section 301. And when Social Security does a medical review, which they do periodically for anyone who's getting benefits, regardless of what that disability is, everyone will have a medical review at some time. When they do the medical review, if they determine that someone is, as they say, medically recovered or no longer disabled, if that individual is participating in an approved vocational rehabilitation training or education program, and to be specific, if they're on a voc rehab caseload, they have to be in plan status for this to apply. Or if they're in school, if they have an IEP, this Section 301 would apply. And they can continue to receive their SSI or SSDI until they complete whatever that program is that they're involved in, whether it's a college degree, a specific training program. as long as Social Security deems the program to be likely to help the person become self-supporting. For example, years ago, I had a client who was in college in voc rehab. She was on a VR caseload. VR was helping with college expense, and she did have a disability that was determined to be that she was medically recovered, but she was able to keep her benefits and the VR help until she completed the college degree and was able to get a job. So now we're going to talk a little bit more specifically about supplemental security income and the work incentives that apply specifically to SSI. And again, the two that we just talked about, the expedited reinstatement and Section 301, those apply to both benefits, SSI and SSDI. And as we said in the beginning, with SSI, income and resources are considered for eligibility, and in some cases, income and resources of family members can affect eligibility. And you have to be disabled by Social Security's rules, and in most states, including Georgia, you automatically get your Medicaid. So when you go to work in the SSI system, because it is a needs-based system, the SSI cash benefit is going to be affected by a portion of your gross monthly earnings. And this slide shows that formula that SSI uses that tells them how much of your gross monthly earnings they're going to count. So in this example, we have someone who's earning $1,088 a month before taxes. And the first thing that SSI does is disregard $20 of this. This is what's called the general income exclusion. So if our individual also was getting a Social Security disability check in addition to SSI, the $20 would be excluded from the disability check. But in this case, we have somebody who's just getting SSI and earned income. So the $20 is excluded, and then the $65 earned income exclusion is also excluded. So what that means is not that Social Security takes $85 out of the person's wages, but that they don't count the first $85. And so now we're looking at $1,003 of countable possible wages, and this amount is divided in half. So that equals $501.50. That is the countable earned income, and that would come off the SSI cash benefit. So this year, SSI 771 is what's called the federal benefit rate. So if you were getting the full amount of SSI and you were earning $1,088 a month, you would still receive $269.50 in SSI, and you would have whatever your net earnings were from your gross wages of $1,088. So in general, even though the SSI check goes down, people are going to realize greater income when they work and have SSI than if they are just getting SSI alone. Now, this is a work incentive that specifically applies to students. And the student has to be under age 22 and regularly attending school. They don't have to be a full-time student, but there are parameters around how many course hours they have to be taking. For this work incentive, Social Security will not count up to $1,870 of earned income per month to a maximum for this calendar year of $7,550. So what that means is if your family member is under age 22 and is a student, then before that formula is applied to their wages, they would have to be earning over $7,550 this year. So that can be a pretty good incentive for young people in school and for families as well, because that SSI cash benefit is not going to be reduced as long as they are eligible for the student earned income exclusion. It could be college, it could be technical school, it could be high school, it could be a training program, anything like that. And the amount that is excluded goes up a little bit every year. Now, unfortunately, this does not happen automatically. So what I always suggest to parents or the individuals with disabilities, if they manage their own benefits, is that if they fall under eligibility for this exclusion, after their first month of work, they would need to go to the Social Security office that serves them in person with a record of what they earned in that first month, with documentation showing that either they are enrolled in school or they are returning to school after a break, because this applies to summer jobs as well. And what I sometimes do, just to make sure, is email them a copy of the SSI policy that explains the student earned income exclusion, in case they get a claims rep who might not be familiar with it. But this is something that is best handled initially by a visit to the Social Security office. And then after that, you don't have to go in. They'll give you advice on what is the best way to report future earnings. But to get this in place, you do need to go in. I've had a couple of cases where the student earned income exclusion, the parent didn't go in right away and they started reducing the check, but once the parent went in, the funds were refunded and the student earned income was applied to the future earnings for that year. So this can really help for young people who are in school and who also want to have some earned income. Now, in a previous slide under the SSDI portion of the presentation, we talked about impairment-related work expenses. Those impairment-related work expenses also apply to people who get SSI. However, there are specific work expenses for individuals whose disability is blindness. And people whose disability is blindness can claim what SSI calls blind work expenses, which allow additional expenses that are not included under impairment-related work expenses. The taxes that are taken out are included as blind work expenses. So for people whose disability, primary disability, is blindness, basically SSI is looking at their net earnings rather than their gross earnings. Transportation, costs of a service animal, meals purchased during the workday are also excluded as blind work expenses. And with blind work expenses, the individual gets a dollar-for-dollar reduction in how much of their earnings are counted, whereas with the impairment-related work expenses for SSI, it's a 50-cent on the dollar reduction. So if the individual's disability is blindness by Social Security's definition and they are on SSI, there are a lot of exclusions they can claim that can reduce how much of their wages SSI is going to count against their eligibility for the SSI check. Continued Medicaid. This is probably the most important and most powerful work incentive for people who are on SSI. And a lot of people think that you have to keep $1 in SSI benefits to keep your Medicaid. But that is, in fact, not true. And if your SSI goes into what Social Security calls non-payment status, meaning your earnings have caused you to no longer get a check, and that amount for this year would be, I think it's a little over $1,600 a month that someone would have to be earning before they no longer got any money from SSI. So if that happens, and the individual is still considered to be disabled by Social Security's rules and meets all the other eligibility rules, and the SSI payment stops due to the individual's own work and earnings, they need Medicaid in order to work, and their income is insufficient to replace what SSI covers Medicaid and any publicly funded attendant care, and this is really important. The income from earnings is no more than the income threshold for Georgia, which is actually this year, it's $31,661. This is actually the 2018 amount. So basically, you could earn up to a little over $31,000 a year and still be eligible for Medicaid under SSI. And in certain situations, if you have very high Medicaid costs that are higher than the state per capita, you could develop what is called an individualized income threshold and have earnings higher than that income threshold and still be eligible for Medicaid under 1619B. And as long as you're under 1619B Medicaid, you're still considered to be under the SSI system. So if you were under Medicaid but not getting a check and then you lost your job, you would not have to reapply for SSI because you're still under SSI Medicaid, you're still in the SSI system, and you would just need to update your status with SSI so that they know you are no longer employed, you no longer have earned income, and then they would restart the check. Because of how SSI does their accounting, when you start working and you report your earnings, it takes 2 months for earnings to impact the check. And when you stop working and update your earnings, it would also take 2 months for the SSI check to start back. But again, you can work and you can have earnings at or slightly above $31,000 a year and still be eligible for your Medicaid. The one sidebar to that is, as everyone knows, if their family member receives SSI and Medicaid, you cannot have more than $2,000 in your personal banking account at the first of every month if you want to maintain Medicaid eligibility. And so that's where the Georgia Stable Program, the ABLE Act, some of you may be familiar with, comes in as a way that you can save money without having it impact your eligibility for your SSI or your Medicaid. Another way that you can set aside income and have it not count against your SSI is a PASS plan. PASS stands for Plan to Achieve Self-Support. And this is another SSI work incentive that a lot of people have interest in and that there's also a lot of confusion about. The PASS plan allows individuals on SSI to set aside income or an excess resource to pay for something that they need to reach a specific work goal. And when they say specific work goal, they really mean specific. You can't say, I'd like to work with computers, or I like working with children. You would say, I would like to get a job as a teacher's aide in a preschool program, or I would like to get a job as a vet tech in a veterinarian's office, or anyway, the more specific, the better for the PASS plan. So the PASS basics are you have to submit a written application for the PASS plan, and it has to be in writing, and it's really best to use the specific PASS form, which is listed on the slide, SSA 545. You can go to the Social Security website and look at this form and see what it looks like. And it is kind of lengthy, and some people find that intimidating, but if you break it down, the questions are really pretty easy to answer. So you do turn in a written application. You have a specific work goal that you want to achieve, and you have to include a time frame and a plan of when and how you are going to reach that goal. That's probably the most important page in the PASS application, is Social Security asks you to spell out what your specific steps are that you are going to take to reach your work goal. What you are saving for in the PASS plan has to be something that is not being paid for by another source. And you have to have income other than your SSI to put into the PASS account. You can't fund a PASS plan with SSI. So that, what would that be? That would be income from employment. That would be if you got another type of benefit like an SSDI or a pension from the VA. That money could go into the PASS account. And once you have a PASS plan approved and you are setting aside that earned or unearned income, SSI does not count it against your eligibility for the SSI check. So for example, if you were working and you had a part-time job and SSI was counting $300 of your wages against your SSI check and reducing your check by $300, and you decided to write a PASS plan to save for some specific training that was going to make you more employable so you could get a better job or so you could work more hours in your current job, and you wanted to set aside that $300, and they approved your plan. Once you put that $300 into the PASS plan account, SSI would no longer consider it as part of your income. You would be eligible for the full $771 of SSI. You would have the non-counted portion of your wages to live on, and you would also be saving $300 a month. So for the right person, a PASS plan can be a pretty powerful tool because you can have as much as you want in that PASS account and it will not count as part of your $2,000 resource limit. Now that's the end of the presentation, and I know it was a lot of information in a short period of time. So I would be more than happy to take questions if there are questions that people would like to ask.
Thank you, Sally, for a very informative presentation. It is now time for our question and answer session. I'll just pull up some questions that people have sent in. So someone says, hi, having $2,000 in the savings account every first of the month may cause you to lose your SSI. Is this $2,000 limit also for people who receive SSDI?
That's a great question. And the answer is no. SSDI is an entitlement program. You are entitled to that check because you or someone or your parent has worked and paid into Social Security. So if you have SSDI and Medicare and there is no type of Medicaid in your benefits picture, you can have more than $2,000 in a savings account. And remember, it's total income. You could, if all you have is $2,000 and you're on SSI, that's okay. But if you have a checking account with $1,000 and a savings account with $2,000, then you're over that $2,000 limit. But SSDI does not have a resource limit like SSI.
Okay. Another question goes, what percentage of payees and beneficiaries know about the PASS plan?
It kind of depends. I can't really tell you. It's a pretty well publicized work incentive, although a lot of people have misconceptions about it, but I don't really know how many people know, a percentage of payees and beneficiaries know about it. But there's a lot of good information about it on the Social Security website, and we have information as well.
Another attendee asked, how many credit hours for students earned income exclusion?
I am sorry, I don't have that information with me. If you email me, or what I can do is I can actually send what would be the best way to handle that? Because I have it back at the office, but I don't have it with me.
Okay, what I would suggest is let this attendee and anybody interested in this send me an email.
Okay.
And when you email it to me, I would pass it on to Sally, and or if she sends it, if you send the answer to me, I would just share it with them.
Okay.
And also I could even do it more general, like the whole attendees are going to receive an email. Post-attending email, and I could just put the answers in there for them.
And one other resource for the amount of hours is, some of you may be familiar with what is called the Red Book, which is a great resource that Social Security puts out that has information about all the work incentives in way more detail than we've been able to go over today. And in the Red Book, if you look up the student earned income exclusion, it will spell out for you exactly what those credit hours are. So you could go to the Social Security website, ssa.gov, and type into the search bar Red Book, and then you could pull up the Red Book electronically and you could see it online. But I will also send the information to Ramatu as well.
Okay. And then someone asked if they could get copies of the slides. So what we do usually after every presentation, we're going to upload on the Georgia Inclusive Post-Secondary Education Consortium website, which I would send it in the follow-up email, post-attending follow-up email. And when you go to that website, there's a link that says the 2019 Parent Webinar Series. You would have to go to that tab. And then when you click on it, you will see all previous webinars, and you see the upcoming webinars. In the previous webinars, which would today's own would soon join that, you would have two links. There will be a link for the PowerPoint and there will be a link for the recording. So everything Sally is saying now is recorded and it will be archived, and it would also be on YouTube.
Oh no. No one told me about that.
Okay, and then
okay, we have some more
questions. There's another question that says, what are the benefits of a stable account for SSDI recipients?
Again, the benefit to the stable account would be if at some point the individual might want to qualify for Medicaid, if you were going to be applying for a Medicaid waiver, the stable account would allow you to have up to $100,000 in that account that would not count towards the Medicaid resource limit. So it really depends on if there's no chance that any type of Medicaid is ever going to be in that person's benefits mix, maybe they don't need a stable account. But if you think at some point Medicaid might be something that would be applied for in terms of maybe getting a waiver, then a stable account could be helpful.
Someone asked a question, but I think you've answered it. It says, can you get a copy of Red Book anywhere or only online? Guessing large.
It is large, you're right. And you can request it. You would have to go to the Social Security website and look up the Red Book, but there will be information there on how to order it. So you don't have to do it online because it's big. But if you go to the Red Book online, it will show you how. I think you can send an email, and there's a number you can call to order a hard copy.
Okay. You can keep the questions coming in. We're still here. Trying to see.
Maybe that's it.
Well, we still have a few minutes to while away before. But okay, I remember there was a question. Someone sent a question before the presentation via email. So we would just go ahead and tell you the answers. There's a question that came to my email that says, does Social Security offer money management classes for adults who are seeking to become their own payees?
And the answer to that is no. Social Security doesn't offer any type of classes like that for money management. We were talking about this before the presentation, and I think that possibly Disability Link, which is the independent living center here in Metro Atlanta, and there are other independent living centers around the state, they sometimes offer money management and budgeting classes, but Social Security, they don't do that, unfortunately.
Then another question that also came in before the presentation says, our son is 35 and he has autism spectrum diagnosis for over 20 years and currently receives no benefits. He is not employed, but will help around with heavy lifting. We both are on Social Security and Medicare, and will probably not be able to retire. I think I need some hand-holding to help with our son's future. Do you have any comments for this person? But we will still reply you in a more lengthy email, but just in case this may benefit anyone.
Well, it sounds like it would, if the individual you know, there's no harm in applying for benefits. Whether the person would be eligible or not is up to Social Security. But what I always say is if the individual has a disability and has not worked, if he's been disabled.
He's above 18.
Yeah. And also, it sounds like he was disabled prior to age 22. He might be eligible for benefits on the parent's record. So in a case like that, the best thing to do is just go ahead and apply for benefits with Social Security.
So I have my own personal questions.
Oh, no. Uh-oh. Hope I can answer.
Yeah, I'm just going to ask it because it may help someone.
Sure, absolutely.
So I noticed in all this talk about limits, income limits and benefits, there was no mention of family size in comparison to income limits.
Right.
So is there anything like that in this process when one
wants to apply? No, it's not like with some other benefits where they, like certain types of Medicaid, look at how many are in your family. But no, Social Security, the only place family comes in is SSI eligibility for people who are under 18. But if you are on SSDI, it doesn't matter. They only look at your earnings. They don't care how many people.
But I was referring to the SSI.
And with SSI, it's the same. It's the same thing. If you are on SSI, it doesn't matter.
You're less than 18. You're a child. And
if you're under 18,
the family's income would be considered.
Right.
But then the family size is large.
Well, if they're under 18 and there are what are called, what Social SSI calls ineligible children, you get a credit for those kids who are not SSI eligible that reduces how much of the parent's income is counted.
Oh, wow.
So with SSI under 18 eligibility, yes, there can be a credit for what they call ineligible children that will reduce how much, that can maybe make the child eligible depending on how many children there are. Is that what you were asking about? Okay,
yes.
Sorry, I went all around the
No, but I get it. I'm happy you answered that for me. So let me just check if there is someone just said she wanted to say thank you to you, and I think I saw a raised hand. I'm coming. Yeah, somebody has raised their hand. So Maya, I see you raise your hand. Let me let you talk. Maybe I don't know if, but you typed, so I don't know what.
Did she type in a question?
No, she didn't type again, but she just raised her hand. She had a question before. Like there were some from her. But let me just Maya, if you are still on, I'm going to let you talk. Let me go to it. Hello, Maya. You can talk.
Did you have a question, Maya? I guess maybe we're.
Yeah, I'm coming. I think somebody else has
another
typed,
question.
Yeah, because I saw now we have 10. Okay.
Oh, okay. Impairment and special conditions. Okay, good question.
This is Maya's
sorry.
Question first.
Okay.
Maya asks,
what is the equivalent of disability link across the state? If you go to the statewide Independent Living Council website, silc.org, I think it is, they'll have a list of all the independent living centers all around the state. I can't list them all off the top of my head, and there may be some new ones that I don't know about. But that's the best place, is to go to the statewide Independent Living Council, or SILC, the SILC as we call it, website, and you can see all the independent living centers listed.
So the next question says, the two impairment and special conditions both apply to SSI and SSDI?
And that's a good question. I'm glad you asked that, because I didn't make that clear. Impairment-related work expenses and special conditions apply. Impairment-related work expenses applies to both SSDI and SSI, but the subsidy and special conditions only applies to SSDI. It does not apply to SSI.
Thank you for
Very
clarifying.
Good question.
Yes, we're still, okay. there's another question. Is there a relay available?
A replay. I think you meant a replay.
Okay. Yes. So for the person that is asking for the replay, there's a link where you could view and listen to the presentation because we recorded it. So you would, once we finish the webinar, tomorrow you're going to receive an email. For those that attended are going to receive an email with a link that tells you how to get to the GAIPSEC website, and via that link you would be able to view the recording. It will still be on YouTube, but it will be easier for you to access it using that route. And the PowerPoint also will be available on the GAIPSEC website. The GAIPSEC means Georgia Inclusive Post-Secondary Education Consortium website. I will send you an email with a link. There's another question that says, how is SSI or SSDI impacted when more than one individual receiving SSI and SSDI live in the same household? It's similar to that.
Yeah, it's kind of what you were asking, but it really depends. If you just have someone, two roommates, one gets SSI and one gets SSDI, there's no impact on the benefits. Or if you have
a household probably family, right?
If you have a brother and sister living together, who one gets SSI and one gets SSDI, as long as the SSI person is paying their fair share of the household expenses, or they've divided the rent up, there's no impact on the benefits. For SSDI, it does not matter what anyone in the household gets. It doesn't matter if you're married on SSDI, the spouse's income does not affect your eligibility, except in the case of if you're drawing as a disabled adult child, if you're getting a check on a parent's record, if you marry someone who is not also getting an SSDI or disabled adult child check, if they're not getting any type of disability and they're working, or if they're getting SSI and you marry them and you are drawing as a disabled adult child, you will lose your eligibility for that check. But if you're just getting SSDI and you marry someone who is getting SSI, you are fine, but the person who is getting SSI, their check will be reduced by a portion of what you are getting from SSDI. So there are lots of different, it kind of will depend on the situation. And if you have a mother who's on SSI and children who are also on SSI, and the mother goes to work, the children's SSI will not be affected unless she no longer receives, and unless she earns at a level where she no longer receives an SSI check. So that's a whole different bunch of permutations depending on the exact situation.
So I have a question too.
Oh no, look what you did. You made Ramatu come up with another question. Okay.
So what if a parent has 3 children with disabilities that all could qualify for SSI? Is there, what does that entail? Who gets, who doesn't get? Does it affect it?
They would all get, depending on the household. Are you talking about if they're under 18?
Yes.
So then it's going to depend. They could all get the full amount depending on what the family financial situation is.
Okay. So another question says, so the cost of a job coach wouldn't count for SSI, only SSDI?
No, you're right. If you pay for it under SSI, it will count as an impairment-related work expense. You have to be paying for it to count under SSI. But under SSDI, you don't have to be paying for it to count towards subsidy and special conditions. So yes, SSI, paying for a job coach could be an impairment-related work expense.
So someone's asked, so for someone who has received SSDI for 24 months, how do they start getting Medicare? Does the parent
need to go back? No, if someone has been getting SSDI for 24 months, they automatically get Medicare. Social Security will send a big old packet of Medicare information about 2 to 3 months prior to the eligibility date. So they should already have gotten that information if they have been getting SSDI for 24 months. You don't have to do anything if you're getting SSDI because of disability, and they will send you the Medicare, and they automatically start it for you.
So someone wanted some questions, more examples for work-related expenses.
Yep, okay, so co-pays for medication, co-pays for doctor's appointments, transportation, let's see, if you have to purchase any special equipment for your job, like the example I used to use was Social Security, you can't use a uniform. If you buy the same uniform that everyone else buys, that will not count as an impairment-related work expense. But if you, let's say you had to buy a uniform that was adapted so that you could, with Velcro or something, so you could get it on and off yourself independently, that would be an impairment-related work expense. If you work from home and there are certain things in your home that you have had to purchase to make your home accessible, and like if you had to buy something for air purifying or something like that, that could be an impairment related work expense. I'll tell you that in the Red Book, again, there is a great chart that lists out a lot of potential impairment related work expenses. If you have to buy disposable supplies like catheters, those could be impairment related work expenses. A lot of times, if it's disability related, necessary for work, and you pay for it, it's worth running it up the flagpole and seeing if Social Security will approve it. There's that great chart in the Red Book. I'm kind of blanking on additional stuff right now, but.
So we're just going to answer this one more question, and if anyone has more questions, feel free to email them to me because our time is up. So this last question says, you may have said this for
do they approve impairment related? Go, okay. To get, you do need to take the first time you report impairment related work expenses, whether it's SSI or SSDI, you would need to go into the office in person and take the receipts showing the costs that you want to submit. And I also think if it's related to medication or therapy, if you can get a statement from the the physician who prescribes it or provides it, saying that it is necessary for this person to work, to have this medication or this treatment or therapy, that's also very helpful. But you don't have to do it every time, but the first time, to make sure it gets where it's supposed to go and gets approved, it's best to go in person.
Okay. Thank you everyone for
really good questions.
yes, for this has been quite interactive and very, very, very good questions. Thank you so much for being a part of this presentation. Thank you, Sally, for a very informative presentation.
You're very welcome.
Yes, do look out for my email, and it would have a very short survey, maximum 3 minutes. I assure you it's not going to take you 5 minutes, just to let us know what you think about the presentation. Let us know, we just ask a few questions about what you want to hear from us again, because this is a continuing webinar. We would keep adding topics based on needs. Feel free to jot down what you think you want to hear about or what you need clarification about. And that's it. Enjoy the rest of your day. Have a blessed weekend. Do send in emails of any questions you have. Thank you.
Thank you. Bye-bye.
Bye. You know that I sometimes can't find what